with your host, Ray Grabowski.
Here's Ray.
Thanks, everyone. Hello, good evening, and welcome to another exciting episode of Meet Clifton. I'm Ray, and this is my co-host, George. How are you, George?
All right, how about yourself,
Good.
Ray?
It's good to see you. As there is every week, there's an abundance of information to share with all of you this evening. For now, let's enjoy the song from the Two Tones Orchestra while we settle in. Hit it, guys.
Ray's guests for tonight's Meet Clifton are rehab specialist Dr. Cheryl Botelho. From the Mental Health Association of Passaic County, Joanne Green and Marcia Takish. And from the Power of One, Kim Castellano. And as always, music by the Two Tones. All this and much more on Meet Clifton.
Welcome to the show. You know, injuries happen to all of us at some point in our lives, and sometimes they can be detrimental to our overall health. There are, however, those who are equipped to assist us in getting back on our feet and on the road to recovery. Our first guest is a rehabilitation specialist, Dr. Cheryl Botelho. Please welcome her to the show.
Thank you so much for coming.
Thank you so much for having me.
Thanks for coming out.
Thank you so
Appreciate
much.
it. Dr. Botelho is affiliated with St. Mary's Hospital right here in Passaic, and our topic today is going to be starting an exercise routine. And we want to ask you, what's some of the best advice for someone who really wants to start or has no knowledge of exercise?
Yeah, so I think definitely the first thing I would want to say is just start something. You know, whether you're starting from the bottom, which means you're a couch potato,
Right.
or, you know, you're somewhat, you know, I'm a walker, but just in the springtime when it's nice, or you're a gym goer, you know, just start wherever you're at.
Right.
You know, so for those people who are kind of those couch potatoes, you know, you just want to start there. You know, that means get off the couch, go down the stairs, and just go around the block once, you know. So one thing that we advise our patients in physical therapy is to use an RPE scale. It's the rating of perceived exertion. And that's on a scale of 1 to 10.
Right.
So 1 means no exertion whatsoever. That's when we're laying down, we're kind of sitting on the couch. 10 means this is the most exertion I've ever felt in my life. We don't want our patients at a 10. We don't want them at a 1. We want them right in the middle. Okay. And that's actually what the American Heart Association supports as well. Moderate activity, 5 days a week for about 30 minutes is actually very healthy, and that's how you support a healthy lifestyle.
Right.
So if you're not quite there yet, and you are definitely not doing that as a couch potato, you can definitely get there, and that can be your goal. But just starting somewhere and working towards that middle line moderate activity,
Right.
that's actually, you know, we can work towards that as a goal. If you're already there at that moderate level, that means you're already there. You can stay at that healthy lifestyle. So moderate activity on that RPE scale, that really should be your goal.
Okay.
So that's definitely what we recommend.
Well, now what I'm thinking, I know you want to say George, not couch potato.
I'm a couch potato.
No.
Go ahead.
But
not
we
you.
talked about this before the show. Now, someone like George that doesn't exercise, but he's very active.
Right.
You know, he's out all the time. But maybe now he wants to start a routine because, you know, you get older and it's good. What would you suggest to him to start? Because you don't just get up and do things. So
Right.
something, what was it, 10 minutes a day for a walk?
Sure, yeah, absolutely. So, you know, if it's an activity that you like. So if, you know, George, what kind of activities do you like?
I have the dog. He's my activity.
Yeah, so exactly. So if the dog wears you out, so you're going to, again, use that RPE scale, and you're going to say, okay, if I'm on a 3 to 4 to 5 and I'm starting to get a little worn out, that's where I'm going to cut it off. And that's, you know, that's exactly where that scale kind of helps you out, because everybody's a little bit different. For me, a 3, 4, 5 may be a little bit different than you. You know, I'm in my 30s. So a certain amount of activity is going to take me a little bit more to get to that level.
I cut off the dog soon.
Yeah, so with the dog, you could end up walking about a
Well, that's
mile
what-
or
yeah,
so,
that's what
a
I've been
half a
doing.
mile.
Yeah.
But for me, on that RPE scale, that's why we like to use it with, you know, a general population, because it's so helpful, because everybody's perceived exertion is just so different. So it's really helpful with a general population.
And I know basically we're talking about people who normally didn't exercise, and there's different types. You know, we have aerobic type and anaerobic.
Yeah.
So I don't suggest or I don't think you would suggest that they jump in on everything, right?
Right, yeah.
I don't know how they would start that slowly with an aerobic stuff before they
Right.
got into maybe, weights or something like
Right,
this. You know,
yeah.
I don't know what the recommendation is for that.
So yeah, there's different types of exercise, and I definitely brought a couple little props here.
Yeah, and please show us.
I
if you-
did. So there's definitely different types of exercise, and you want to definitely do a fullness type of exercise. So that means, you're right, cardiovascular exercise, which just means getting the heart pumping. So that could just be doing anything, like we were saying with George, walking.
Right.
That could. So that's walking, cycling. That's swimming in the summertime. But then you have weights. You could be doing just some general free weights. A lot of
Right.
people just have these hanging around their houses. And a lot of times even on Verizon cable, there's a lot of different things we can be doing. There's programs where you can just plug in and,
Right.
and just do some weight programs. There's,
And they have light ones for George, right?
oh, they do.
Very light.
But I think George
Those
can
are
handle.
too heavy.
I think he can handle more.
No, they're too heavy.
There's some resistance bands if people really aren't a fan of that. So there's resistance bands where again you can just be doing some resistance band work, which that's actually very popular right now. But one other component that's really important besides just getting your heart rate up and then doing the strengthening is flexibility. So that's something we use in the clinic a lot, is just for, we'll hook this into
Yeah, that's what I wanted to
foot.
ask too.
Yeah.
How important is
It's just
stretching?
getting and then stretching.
Okay, stretching's
Very,
important.
very important. That helps prevent injury.
Okay.
Very much so.
Is it better to stretch before or after, or?
You want to
both?
get a little bit of a warm up because your muscles, they're like rubber bands. You want to warm them up a
Right.
little bit and then stretch them out. So you definitely want to get a little bit of a warm up and then get your stretching going. But yoga is actually another great exercise that gets the strengthening and gets the flexibility component, which a lot of, there's a lot of good yoga programs out there that are great for everybody at every level.
How important is routine?
Very important.
Okay,
yeah.
that's
Yeah.
we need to discuss that a
That's
little
half
bit.
the key right there.
Right, and that's why I want to, this is what your expertise is.
Right.
Routine, is it 1 day a week, 3 days, or is it contingent on what the person wants to do?
Really, first it's what you can do.
Right.
Obviously, if you have a certain, work schedule or you have to go watch your grandkids, you really have to kind of make it work for your lifestyle. That's the first thing. But, consistency is key. You have to make it, you have to schedule it in for yourself as if it's your own appointment. That's, that's one thing we actually tell patients a lot of times. You have to schedule your exercises in as if
Right.
it's your own appointment.
Okay. And injuries. A lot of people, they have injuries. So how do they start a program?
Yeah,
'Cause,
so.
chronic back illness, whatever, but you still want to exercise even if you're injured.
Right,
So-
absolutely. So there's different types of injuries. One thing I'd say is if you have a progressive injury, something that pain just seems to get worse and worse, my recommendation, quite honestly, as a healthcare professional is go see a doctor. Progressive pain is just not normal. That's not something that I'd consider, like, just work through it,
Right.
That's just not something I'd recommend.
Okay.
If it's something like general back pain, knee arthritis, these are all things that actually activity does help. So I'd encourage just start with that light activity and see what happens.
Okay.
And quite honestly, with physical therapy, in the state of New Jersey, we do have direct access. So if you are having pain and you're active, you can actually just come to a physical therapy clinic and we can evaluate you because of direct access, which means you can come make an appointment with us and we can evaluate you.
Okay. And I just, maybe one last point I want to make, because this is a lot of
Mm-hmm.
information. You can't afford a membership, gym membership, but you want to start somewhere.
Right.
Are there in the community activities or things you could do at home, just so that the people?
Yeah, absolutely. There's a lot of great community programs. I know in the town of Clifton, the rec department actually is very supportive of this. There's a walk and talk program. There's numerous programs for seniors 65 plus. There's Silver Sneakers.
Right, Silver Sneakers.
Yeah, Silver Sneakers, which is incorporated into most insurance plans. You have to call the company,
Right, right.
your insurance company, and see if it's incorporated. But most towns nowadays do incorporate free activity programs
Right.
for all ages.
Right,
Again,
I know
so
Clifton has things
Clifton
like that,
does,
yeah.
absolutely. They're very supportive of that. So you just have to call, you can go on the website, you can even call the town if you're not comfortable with going on, the internet. So, but very much so. A lot of
Right.
free activity programs.
All right, so Dr. Cheryl, thank you for coming on, because it's
pleasure.
important to start a routine.
Yep.
You have more information, please look it up on the web or the Clifton site, or you can even contact St. Mary's for more information on
Absolutely.
rehab. Thank you very much. Me, Clifton, will be right back. Stay tuned.
Thank you.
Hi everyone. Shred Day in Clifton will be on Saturday, April 14th, rain or shine. It'll be from 8 a.m. to 12 p.m. at the Clifton Senior Center. That's located on City Hall property at 900 Clifton Avenue. This is for Clifton residents only. You have a chance to shred and recycle all of your confidential documents like tax returns, old checks, utility bills, credit card statements, medical information, bank statements, and other personal records. This is free of charge, and residents must show proof of residency. For questions, you can call the DPW Recycling Division at 973-470-2239.
Thanks for sticking with us. You know, mental health and illness is a very controversial topic in the world, from the language we use to talk about it to how we should handle it. Mental health also covers a broad range of topics, each with their own issues to tackle. Here to explain in better detail are Joanne Green and Marcia Takish of the Mental Health Association of Passaic County. Welcome, ladies. Thanks for coming on. I appreciate it.
Thank you. Our pleasure.
This is actually, it is a controversial topic at this time, and you know, we want to know, you know, it's okay to talk about mental illness because people should be aware. Now we see all the signs around Clifton, stigma-free. So let's just start
Yeah,
there.
well, actually, you're going to see a lot more signs around Clifton because we just had the city council approve these very big permanent signs, which say exactly what my shirt says, which is Clifton proud to be stigma-free. And the reason that we're doing this is that we want to destigmatize mental illness because what happens is about 1 out of 4 people in this country have some form of mental illness, and there's a wide range, a wide spectrum of what a mental illness can be. But 1 in 4 Americans have a mental illness, but unfortunately only like 40% of those people go and get treatment. And one of the reasons for that is that they feel there's some shame or an embarrassment, and there's a tendency for us to for people to isolate themselves and not reach out for help. So this is a way of opening up the dialogue in the community and trying to get people who are interested in this area to come out and work towards making it more of less of a taboo subject.
Right. Any one of us could feel like we have a problem. So how do we know when to seek help? You know, for yourself or someone else. How, you know, what starts the process?
One of the things we actually do different scales to make that determination to see how people to determine where people are, and we often look at depression.
Right.
So what we try to do is we try to help people understand that we actually do test them ourselves to see where they stand on a depression scale. So one of the things we ask people to do, it's not just working with the individual, but it's helping the families understand that if you find certain symptoms or certain changes in a person, then you need to pay close attention to it. And some of them are issues like if people start to isolate, if you have very friendly people and all of a sudden they begin to isolate a little bit more, they complain about sleeping more or not being able to sleep, they're losing weight because they're not as hungry or they're eating more. Maybe their attention span isn't as good, where they used to be very detail oriented and they're just not following up with things. So it's really important, I think, to educate the family to look for a lot of the signs. And especially, we were talking a little bit before about it's important to start focusing on children and looking for some of the differences with kids. So those are some of the things you need to start looking for, or any kind of unusual behavior, anything that's out of the ordinary. Just at some point, I think it's just important to just say what's going on here. Just start asking the questions and follow up.
Mm-hmm. Right now, someone comes to you now. Is there an evaluation process?
There is.
That's important. Are there certain questions someone's asked?
Yes.
Because you have to ascertain.
Yes.
I don't really know how to do this, but I see you have like a checklist. I don't know if that's.
This is just for depression, but yes,
depression.
I could.
But they would come to you and
There's so many questions, yeah.
Right, and from all of these questions, you could actually.
Right. Well, we do assessments. We have a pre-intake. Most places have this, so it's not just our agency, but a lot of places they have a pre-intake. You get the initial information, the insurance information, emergency contacts, and then the actual intake is getting pertinent information, a lot of relevant information, and we do adverse child. We look to see if they had any kind of an adverse childhood, because that's a definite link or a definite sign that maybe there is something going on, we have the suicide assessment. This is a suicide assessment that I brought with me. And it's pretty detailed, and we need comments. We need people to elaborate. And we have a regular general intake, and we ask, what is your presenting problem? What's going on? We just start from the beginning. What is happening? What's changing? What is your problem as you see it? And we want to know in their words what's going on. And then we just keep asking a lot of questions. But one of the most important things, I believe, is to check the suicide.
So in talking about suicide, which I know you just brought the topic up, what are some of the signs to look out for that someone's at suicide? 'Cause, talking depression here, and sometimes depression leads to suicide. How do we?
We ask them, it's really important, again, especially we go back, we actually ask them, have you ever made an attempt? How old? How many? How often were you hospitalized? What type of an attempt did you make? How long ago is really important. If something they did maybe when they were 15 or 16 and then they're 40 now, I'm feeling a little bit more comfortable about that. But have they ever given any thought? If they were to, like, is there an intent? Is there a plan? If they ever did plan to, if they ever thought about it, do they have a specific plan? That's very, very important, because if someone gets to the point where they actually think it through, that's saying they're pretty serious about it.
Right.
So when we get something like that, what we do is we'll actually ask a lot. We'll have a lot of other forms that we're going to ask, a lot of other questions to make even a further determination about where they stand with any potential suicidality.
And I understand where that's going with that, but let's just say people watching now, they know someone. So just to finish this out, because we could talk about this for a long time,
Yes,
but
right.
where can people go for help? Because that's the most important. Someone watching this, saying,
Right.
I know someone, so what do we do from here?
Okay, well, we recently opened up an outpatient clinic. So we provide help at therapy, and also we have a psychiatrist. But at this point, we're just taking people who have Medicaid. So
Okay.
there are other clinics that are available, and there's also people who have private insurance. There's psychologists, social workers, and psychiatrists who also provide help.
Okay.
One thing, if somebody thinks that they might want to get some help, they can always call the Mental Health Association,
Right,
and we can
right.
direct them to,
Okay,
if we can't.
If you know someone needs help, please contact one of the agencies. I know we talked a little bit about it, but it's important because,
Yeah.
mental illness is something we really want to deal with.
Right. I think the thing is that people sometimes don't know how to approach someone that they
Right.
see is acting a little differently, and they don't want to, they're afraid, but it could be as simple as, I've noticed that you've been sleeping a lot more lately, or I noticed you're not eating as much and you're losing weight. Is something going on? Do you want to talk about it?
Right.
Just leaving the door open. And even with suicide, people are afraid to even say the word.
Right.
So they're afraid that if they ask somebody about that they might make a suggestion, that person might follow through. There's no way that you are going to be giving them an idea that they didn't, if they didn't have it already. So that, don't be afraid to ask the question.
Right. Okay. So the important thing is, if we know someone or something, we should get help, and hopefully we could come back on and talk about this again.
Exactly.
But thank you for this bit of information. It was helpful. Thanks for coming on. Stay tuned. We have another fantastic guest right after this.
Okay, thank you very much.
Hello, Clifton and friends. Welcome to the updates. Well, the Clifton Maine Memorial Library will be having a guest speaker and author, Michael Gabriel. He wrote a new book, New Jersey Folk Revival Music, and that will be on Thursday, April 19th at 7 p.m. He'll have a book signing, a discussion, and some musical selections. So please consider going to Clifton Maine Memorial Library, and that's 292 Paget Ave, and that's Thursday, April 19th, 7 p.m. Now, let's clean up a park in Clifton. It's Dundee Day Cleanup, and that is Saturday, April 21st, 9 a.m. to 12 p.m. So please consider cleaning up the park so it's enjoyable by everybody. Then, May 5th, the Athena Veterans Post is having their 72nd anniversary dinner dance. Tickets are $40 a person. It will be from 6 p.m. until 10:30. They're located at 147 Huron Ave, and the number is 973-778-0931 for tickets. It's a full night of dinner, dancing, fun, great food, so please consider going to that, and hopefully we'll see you at all the other events. Thanks so much.
Thanks again for tuning in. Everyone has their personal bubble. Some are comfortable expanding that bubble to include the people they are around the most. Some expand even further than that, and some aren't very comfortable expanding their bubbles at all. Here to explain more about personal boundaries is Kim Castellano of Power of One Ministries.
Welcome, thanks. Good to see you again.
Welcome, Kim. Thanks for coming in. Kim is here today to talk about boundaries. She's the Power of One, an outreach program. I guess that's what it is. They do a lot of different things with personal counseling and stuff, but tonight we're going to talk about the topic of boundaries. So to start off, what are boundaries?
Well, personal boundaries basically are guidelines, limits, rules that people have that identify themselves.
Right.
And they also are used to protect yourself from people and the way they behave. So it's kind of like I always say they're invisible fences, or like in my workshops, I always say this is your space.
Right.
Or I say this is my hula hoop, or we laugh, we think that's funny. But this is basically your space, and you only allow, some stuff in and some stuff you keep out. So we have fences, so those invisible. I mean, it's kind of like a no trespassing sign.
Yeah, that's what I was going to say. It's like a no trespassing sign.
Yes. So the no trespassing sign, there's consequences. So with personal boundaries, actually trespassing, you can see the sign, you see the fence, right? And you know that if you go past it, there's consequences. But with personal boundaries, they're invisible. And they change, okay? So it's hard to identify someone's boundaries, but there's consequences, and they do get damaged over time.
Okay, so, we're talking about personal space. Is
Yeah,
that
that's
basically the
basically
same thing?
it.
This is my personal space. So why is it important to have boundaries? And is this on personal level, business level? What are we determining
Well,
here?
the workbook that we're doing is boundaries. So
Okay,
it's
yeah, I have a copy
it's a 9-week series, and we are going to look at all the different boundaries, the boundaries that you have in relationships, boundaries that you have with your children,
Right.
the workplace. So each area of your life, you have boundaries. You have what you're allowing to come into that space, even at your desk at work.
Right.
So you have some workspace boundaries, but you need to clarify them or identify them so that you can communicate in a healthier way.
Okay, so on a relationship level, let's just say, in the workplace, okay, sometimes people are more aggressive with someone. How do you set those boundaries?
Well, you have to demonstrate that when someone comes to in our workshops, like in the stress coaching, we used to role play because a lot of people would have people come into their office and screaming and yelling at them.
Right, exactly.
So let's just say that someone comes into your office, and I've had that in the past, where I've
Right.
worked someplace where people would come into my office and they would scream at my desk, and I'm like, wait a minute, you've just, broke that trespassing, and please don't come to my desk like that and speak to me, because that's your protection. You're protecting
Right.
the way people behave. So sometimes those boundaries are really damaged from childhood. So they're not there. So you're out of fear.
Right.
You're just allowing that person to come in and really treat you in an inappropriate way. So setting up healthy boundaries actually lets you live more freely and fully.
Okay.
So, and not out of fear.
All right, and now this all could relate to family.
Yes.
The dynamics, brother, sister, mother, father.
Yes.
And it's not putting your family members in place, but how do you deal with this? Maybe you have an aggressive sister or brother. So how would you explain that? How do you tell somebody, how do you set that boundary is what I'm trying to say.
Well, you have to communicate them. So,
Exactly. All right, so how do you do that?
have to communicate them. You can say, actually in the workshop, we have adults who are working on boundary work that are new to this.
Right.
So they're letting their family members know that, listen, can you respect my time right now, because I'm starting to work on some healthy boundaries. I love you, I care about you, but I want to be able to, communicate to you in such a way. We need to either put some distance between our relationship right now so I can work on my space.
All right.
So you're going to have, you're going to lose some relationships. You're definitely going to lose, when you start doing boundary work, you're going to lose some of your relationships.
Because you're determining your needs and you're
Yes.
expressing it to that person.
Yes.
So it's a communication
Yes.
exercise.
Yes, absolutely. So you're going to better your communications on all different levels.
Right.
So whether it's your family, your relationships, workplace, even in organizations, if you work with people.
Right. So someone who's maybe not confrontational, they're going to have a tougher time with this.
Yeah, so those are the compliant
Right.
people. And again, we have fences. And, if you've been brought up in such a way where you weren't able to express this, and
Right.
I always say, growing up, some of us grew up in a dysfunctional home. So we weren't modeled or demonstrated healthy boundaries. So when we were put out into this world as adults, we all of a sudden say like, oh, there's rules here, there's limits, like, really? I didn't have that growing up. That's foreign to me, so I don't understand what you're talking about. So, you become, sometimes, the consequences are jail. Some people, that's the
Right,
extreme.
and
Or you lose your license.
what we need to know is
but
just-
when you're growing up in a dysfunctional home, there are no limits, there are no rules.
Right.
It's a,
In real life, there's consequences.
and in real life there is. So
Right.
that's where I see how boundaries
Okay,
can really
so
help.
just to finish up a little bit here,
Mm-hmm.
what tip can you share about, what's a tip you can just give the people right now
Okay.
for setting boundaries?
So setting up boundaries, healthy boundaries, does take time and it's a process. So developing a support system of people who are going to respect you, that you're doing this type of work. So people that are for you. So that's why we have this workshop. So that's the place of a safe place for you to come and to start practicing, because you're going to practice, you're going to make mistakes,
Right.
you're going to hurt some people's feelings, and then you're going to go back and you make the amends and say, listen, I just, respect me in my space, but I'm working on myself. So in the workshop, that's kind of the dynamics of taking people along with you, because it takes time. It's a process.
Okay, so, we appreciate you telling a little bit. I know this is a big topic, but if people are interested, you could find out more about this topic, but I'd like to thank
Yes.
you for coming on.
Yes, thank you so much.
Ms. Castellano. More Meet Clifton is on its way. We'll be right back.
Gypsy woman told my mother on the day I was born, said you got a boy child coming, gonna be a son of a gun. Gonna take pretty women's, leave me by my hand, the whole wide world gonna know I'm the hoochie coochie man because I'm here. Everybody
Well,
knows.
chalk up another episode of Meet Clifton. We're done for the night. We had some fantastic guests who shared their valuable information with us, and we hope that you've learned something valuable from the experience. As I like to do at the end of each episode of Meet Clifton, let me thank my co-host George and the rest of the cast and crew for all their hard work and dedication, because none of this would be possible without all of you. And from all of us, remember to be good to your friends and family, respect your neighbors, keep Clifton close to your heart. This is a great city. Thank you, God bless, and good night.